I'm about to reveal something that could be sitting in your medicine cabinet right now, something you take every single morning thinking you're protecting your health, when in reality, it might be slowly poisoning you. I'm Dr. Sarah, and after 7 years specializing in geriatric medical problems, I've watched too many seniors suffer from symptoms they blamed on aging, fatigue, dizziness, joint pain, memory fog, when the real culprit was sitting right there next to their coffee maker. A vitamin bottle, a supplement they trusted completely. Now, before I tell you which vitamins are dangerous after 60, I need you to understand something critical. This isn't some fringe theory. This comes from peer reviewed research, large scale clinical trials involving over 25,000 seniors, and from watching my own patients transform their health simply by stopping certain supplements and starting others. But I'm not going to tell you which ones yet, because if I do, you might click away thinking you already know the answer, and you don't. Trust me, the vitamins I'm about to reveal will shock you because they're the exact ones that have been marketed to seniors for decades. Let me tell you about Margaret first, because her story will help you understand why this matters so urgently. Margaret was 68 years old, a retired teacher from Pennsylvania. She did everything right, or so she thought. She took her multivitamin every morning without fail, extra calcium for her bones, iron because she'd been slightly anemic in her 40s, B complex for energy. Now, even a senior formula with extra vitamin A because she'd read it was good for vision. For about 8 months, Margaret started feeling off. Not sick exactly, just declining. She'd get dizzy when she stood up too quickly. Her joints ached constantly, especially her knees and hips. Her skin became dry and itchy no matter how much lotion she used. Her hair was brittle, breaking easily, and she was exhausted all the time, even after a full night's sleep. Margaret went to her doctor 3 times. Each time she described her symptoms, each time the doctor ran basic blood work, and each time the results came back, quote, normal for your age. The doctor prescribed a cream for her skin, suggested glucosamine for her joints, and told her the fatigue was probably just part of getting older. Maybe she needed to exercise more, eat better, reduce stress. But Margaret was already eating well. She was walking every day. She wasn't under particular stress. Yet she kept getting worse. Then one morning, Margaret woke up with severe chest pain. Her heart was racing irregularly, pounding so hard she could feel it in her throat. Her husband called 911. By the time the ambulance arrived, Margaret was in full atrial fibrillation, a dangerous irregular heartbeat that dramatically increases stroke risk. In the emergency room, the cardiologist ran comprehensive tests, and that's when they found it. Margaret's vitamin A level was more than 3 times the normal range. She had vitamin A toxicity. Her liver was struggling to process it. Her body was storing it in her fatty tissues, and it was affecting her cardiovascular system, her skin, her joints, her energy, everything. The cardiologist asked about supplements. Margaret showed him her bottles. Between her multivitamin and her senior vision formula, she was taking over 10,000 IU of retinol form vitamin A every single day for 8 months straight. The recommended upper limit for seniors is 3,000 IU. She was taking more than triple that amount, thinking she was protecting her eyesight. It took Margaret 4 months to recover, 4 months of stopping all vitamin A supplements, working with a nutritionist, managing her heart rhythm with medication, dealing with ongoing fatigue. 4 months that could have been avoided if someone had just told her that after 60, her body handles vitamin A completely differently than it did at 40. If Margaret's story sounds familiar, if you're taking vitamins thinking they're only helping, comment, yes, I do OG Sarah right now. Let me know you're following along, because what I'm about to tell you next could literally save your life. Now, let me tell you which 4 vitamins become dangerous after 60 and exactly why. Dangerous vitamin number 4, vitamin A in retinol form. Here's what most people don't understand. Vitamin A is fat soluble, which means it doesn't flush out through your urine like vitamin C or B vitamins. Instead, it gets stored in your liver and fatty tissues, and it can stay there for months, even years. When you're young and your liver is working at full capacity, this isn't usually a problem. But after 60, your liver slows down. It processes things less efficiently. Your fat distribution changes. You metabolize differently so that vitamin A accumulates past a certain point and it becomes toxic. And a 2022 review in the European Journal of Clinical Nutrition looked at seniors with elevated vitamin A levels. What they found was striking. Those individuals had a 25% higher risk of developing atrial fibrillation. That's exactly what happened to Margaret. You're taking this vitamin thinking you're protecting your eyes, and instead you might be increasing your risk of stroke. Here's the critical number. If your multivitamin contains more than 700 micrograms per day for women or 900 for men of retinol or retinol palmitate, those are the synthetic forms, you're in the danger zone. And most senior-focused supplements blow right past that number without any warning on the label. The solution switched to beta-carotene from foods, sweet potatoes, carrots, spinach, butternut squash. Your body converts beta-carotene into vitamin A, but only as much as you actually need. It's self-regulating. There's no risk of overdose because your body stops converting once you have enough. Dangerous vitamin. Number 3, iron supplements. Now, this one surprises people because we've been taught that anemia is dangerous, especially in older adults, and that's true. But here's what nobody tells you. After menopause for women and after age 65 for men, your need for iron drops dramatically. Unless you're bleeding, you're probably not deficient. The problem is excess iron. Iron is also stored in your body, and too much of it creates something called oxidative stress. Think of it like rust forming on metal. Iron literally causes cellular rusting inside your body, damaging your heart, your liver, your pancreas, and especially your brain. Research shows that elevated iron levels in seniors are linked to a 36% higher risk of heart attack and increased risk of Alzheimer's disease. Yet many seniors take iron supplements daily or take multivitamins with 100% of the daily iron value, thinking they're preventing anemia. Here's what you should do. Get tested first. Ask for a ferritin test, not just hemoglobin. Ferritin shows your iron stores. If it's above 100, you don't need supplemental iron. If it's below 30, then yes, supplement under medical supervision. But never, ever take iron just in case. The risks are too high. If you're starting to realize that more isn't always better when it comes to vitamins, especially after 60, comment, "Yes, I do, OG Sarah." I want to know this community is learning these critical truths together. Dangerous vitamin number 2, calcium alone. Without vitamin D3 and K2, calcium has been pushed on seniors, especially women, for decades. Strong bones, prevent osteoporosis, reduce fracture risk, and calcium is essential. But taking calcium alone, without the cofactors your body needs to use it properly, is one of the most dangerous supplement mistakes you can make after 60. Here's what happens. When you take calcium by itself, your body absorbs it into your bloodstream. But without vitamin D3, it can't efficiently transport that calcium into your bones where it belongs. And without vitamin K2, your body doesn't know where to put it. So instead of strengthening your bones, that calcium starts depositing in your arteries, your kidneys, your soft tissues. And a landmark study in the British Medical Journal found that women taking calcium supplements alone had a 30% higher risk of heart attack. Not lower, higher. They were trying to prevent fractures and instead were increasing the risk of cardiovascular disease. And here's the heartbreaking part. For many women, the calcium didn't even help their bones significantly because without vitamin D3 and K2, their bodies couldn't use it properly anyway. The solution, if you need calcium, take it with vitamin D3 and vitamin K2. Better yet, get most of your calcium from food, leafy greens, sardines with bones, fortified plant milks, yogurt, and always ensure adequate vitamin K2, which directs calcium into bones and keeps it out of arteries. Dangerous vitamin. Number 1, high-dose vitamin B6. This is the one that breaks my heart the most because it's often marketed specifically to seniors for nerve health and energy. And yes, vitamin B6 is essential, but the dose makes the poison, and too much B6 causes irreversible nerve damage. The official safe upper limit is 100 milligrams per day, but research shows that even 50 milligrams daily, taken over long periods, can cause toxicity in older adults. And here's the scary part. Many nerve support formulas, many energy boosters, many senior multivitamins contain 100 to 250% of the daily recommended amount in just one serving. The symptoms start subtle: tingling in your fingers and toes, numbness, burning sensations, loss of balance, difficulty walking. These are the exact symptoms of peripheral neuropathy, which is exactly what too much B6 causes. And the cruel irony, many people are taking high dose B6 to treat nerve problems when the B6 itself is making those problems worse. Let me tell you about Robert, because his story shows how this happens in real life. Robert was 72, a retired electrician from Ohio. For about 2 years, he'd been experiencing tingling in his feet and hands. It started mild, but gradually got worse. His doctor diagnosed him with diabetic neuropathy, even though Robert's blood sugar was well controlled. The doctor suggested he try a B-complex vitamin for nerve support, something he could buy over the counter. Robert went to the pharmacy and found a nerve health formula specifically marketed to seniors. It contained 100 milligrams of vitamin B6 per serving, more than 60 times the amount he actually needed. The bottle said it was safe, effective, doctor recommended. Robert started taking it twice a day, thinking if one dose was good, two would be better. For 6 months, Robert faithfully took his nerve vitamins. But instead of improving, his symptoms got worse. The tingling became constant. He started losing coordination. He had trouble buttoning his shirts. He dropped things. His walking became unsteady. He fell twice in 3 weeks. His doctor ran more tests. Diabetes, still controlled. Circulation, fine. Vitamin deficiencies, no. Then a neurologist asked about supplements. Robert brought in his bottles. The neurologist immediately identified the problem: vitamin B6 toxicity. They tested Robert's B6 level, and it was nearly 5 times the normal range. The high-dose supplement he was taking to help his nerves was actually destroying them. The neurologist explained that nerve damage from B6 toxicity can take months or even years to recover, and sometimes it's permanent. Robert stopped the supplement immediately. 9 months later, some of his symptoms had improved, but he still had residual numbness in his feet. He still had balance problems. He'd gone from an active, independent 72-year-old to someone who needed a cane and couldn't drive safely, all because a vitamin bottle at the pharmacy told him this was helping. If Robert's story shows you how dangerous it is to assume all vitamins are safe, especially in high doses, comment, "Yes, I do, OG Sarah." Show me you're understanding these critical lessons that could protect you. Now here's what you actually need to know about B6. Seniors only need about 1.5 milligrams for women and 1.7 for men daily. That's it. Not 50, not 100, less than 2 milligrams. You can easily get this from food: chickpeas, tuna, turkey, bananas, potatoes, fortified cereals. If your multivitamin or nerve support formula has more than 5 to 10 milligrams of B6 per serving, it's time to switch. Don't take high doses just in case. When it comes to B6, more is genuinely dangerous. So those are the 4. Vitamin A in retinol form, unnecessary iron, calcium taken alone, and high-dose B6. 4 vitamins that sound helpful, that have been marketed to seniors for years, but that after 60 can quietly cause real harm. Now let me shift gears and tell you the 4 you absolutely must take if you want to stay strong, steady, and sharp well into your 70s, 80s, and beyond. Essential vitamin. Number 4, magnesium. If there's one nutrient almost every senior I see is running low on, it's magnesium. And the tricky part is you don't even know it's missing until your body starts sending signals: trouble sleeping, muscle cramps at night, unexplained fatigue, restless legs, even an irregular heartbeat. Magnesium is involved in over 300 biochemical reactions in your body. It keeps heart rhythms stable, allows muscles to contract and relax properly, supports nerve and brain activity, regulates blood sugar, and strengthens bones alongside calcium and vitamin D. But aging creates a hidden problem. Your body absorbs less magnesium from food, and many common medications, blood pressure drugs, reflux medicines, diuretics actually drain magnesium faster than you can replace it. A 2018 study in the journal Nutrients found that magnesium deficiency in older adults was linked to a 50% higher risk of atrial fibrillation, the same dangerous irregular heartbeat we talked about earlier. It's also associated with dementia risk, type 2 diabetes, and chronic inflammation. When deficiency is corrected, the changes can be noticeable. Deeper sleep, fewer muscle cramps, sharper focus, steadier mood, better balance, fewer falls. Not all magnesium supplements are equal. Cheap forms like magnesium oxide absorb poorly and often cause diarrhea. Better options are magnesium glycinate, citrate, or malate, gentler and far more absorbable. Most seniors need around 250 to 400 milligrams daily depending on diet and health. Essential vitamin. Number 3, vitamin D3. If magnesium is the helper, vitamin D3 is the master switch. It determines bone strength, immune defense, and brain function. After 65, your ability to make vitamin D from sunlight drops by more than 50%. Combine that with indoor living, sunscreen, or weak sunlight in northern regions, and deficiency becomes almost inevitable. Vitamin D3 isn't just a vitamin, it acts like a hormone affecting nearly every system. It regulates immunity, supports cardiovascular health, reduces inflammation, and protects brain cells, lowering risk of depression and cognitive decline. Here's the powerful part. A 2022 study following over 25,000 adults found that those taking vitamin D3 had a 36% lower risk of death from all causes. That's massive. That's one of the strongest protective effects we've seen for any supplement. But many people make mistakes. They take vitamin D2, the weaker form, or doses too small to reach optimal levels. Most seniors require about 2,000 to 4,000 IU daily, though blood testing is the only way to know for sure. The target blood level is 40 to 60 nanograms per milliliter, while many seniors fall between 15 and 25. And vitamin D3 works best with vitamin K2 and magnesium. D3 absorbs calcium, K2 directs it into bones instead of arteries, and magnesium activates the entire process. They work as a team. If you're realizing that the right vitamins in the right doses can genuinely transform your health after 60, comment, "Yes, I do, OG Sarah." Let me know you're part of this informed community. Essential vitamin. Number 2, vitamin K2. Most people have never even heard of vitamin K2, but it might be one of the most important nutrients for senior health. There are 2 types of vitamin K. Okay, one handles blood clotting. K2 directs calcium. Here's why K2 matters so much. It activates proteins that push calcium into your bones where it belongs and keeps it out of your arteries where it causes harm. Without K2, even if you're taking calcium and vitamin D, that calcium can end up hardening your arteries instead of strengthening your bones. The Rotterdam study, following over 4,800 people, showed that those with the highest vitamin K2 intake had a 57% lower risk of death from heart disease and significantly stronger bones. That's the power of directing calcium properly. There are 2 forms of K2, MK4 from animal foods and MK7 from fermented foods. MK7 works best for supplements because it stays active longer in your body. Most seniors need about 100 to 200 micrograms daily. Food sources include natto, a Japanese fermented soy dish, hard cheeses, egg yolks, and chicken. But most people need supplementation to reach optimal levels. Essential vitamin number 1, omega-3 fatty acids, EPA and DHA. After 60, this may be the most valuable supplement you can take because it supports nearly every aging system. Omega-3s help memory and lower Alzheimer's risk. They reduce inflammation throughout your body. They stabilize heart rhythm and lower heart attack and stroke risk. They ease joint pain, improve mood, and preserve muscle strength and mobility. But here's the critical part. You need marine omega-3s, EPA, and DHA from fatty fish, fish oil, or algae supplements. Plant omega-3s from flaxseed or walnuts convert very poorly in the body, especially as you age. Most seniors need around 1,000 to 2,000 milligrams of EPA and DHA combined daily. And choose purified, third-party tested fish oils to avoid contaminants. And if you're on blood thinners, consult your doctor about dosage because omega-3s have a mild blood thinning effect. So let me bring this all together for you. After 60, avoid retinol, vitamin A in high doses, unnecessary iron, calcium taken alone without D3 and K2, and high-dose vitamin B6. After 60, prioritize magnesium for 300 plus body functions, vitamin D3 for immunity and longevity, vitamin K2 to direct calcium properly, and omega-3s EPA and DHA for brain, heart, and whole body health. This isn't about taking more supplements, it's about taking the right ones in the right forms at the right doses. Margaret learned this the hard way with vitamin A toxicity. Robert learned it with B6 nerve damage. But you don't have to learn the hard way. You can make these changes today. If this video gave you valuable information that could protect your health or help someone you love, comment, "Yes, I do OG Sarah" right now. Let me know you're part of this community and that this information matters to you. Go to your medicine cabinet today, read those labels, check the doses, make the changes, share this video with your friends, your siblings, your parents, anyone over 60 who's taking vitamins without really knowing if they're helping or hurting. Subscribe to this channel because I'm bringing you the latest medical research that actually matters for seniors, the information your doctor might not have time to explain, the truths that could add years to your life, and life to your years. Bookmark this video, review it before your next doctor's appointment, bring it up, and ask questions. You deserve answers. This information could prevent a heart attack, avoid nerve damage, protect your brain, and help you stay independent and active for decades to come. Thank you for being part of the OG Sarah community and for watching all the way through. Take care of your health, and I'll see you in the next video.